maybe share their experience? If not, that's fine, and I can just continue. Okay, so I'll continue with the presentation, but if anyone has some kind of IPE experience that they'd like to share, just type it up in the chat and we can maybe go through that at the end of the presentation, because that would be really cool to see maybe things that your association or your school has done in terms of IPE. Okay. So what is IPE? A lot of you already know. IPE is interprofessional education. It consists of activities or events with collaboration between individuals that study to become healthcare professionals. So pharmacists are members of a multidisciplinary team, and this is a team of many healthcare professionals, and that can include pharmacists, doctors, physiotherapists, dentists, and many, many others. Collaborating and working alongside each other helps to improve and optimize these health targets and healthcare for the patient, and it's necessary for great health outcomes. So what is a teddy bear hospital? So the teddy bear hospital is an event in which many students from healthcare professions join together to create a sort of hospital for children and their teddy bears. The event is open to the general public and it encourages families to bring along their children to participate. So often children can be scared of their doctor or their dentist, or they may not just know much about what the role of, say, a pharmacist does. So the Teddy Bear Hospital helps to educate children at an early and developing stage of their life to teach them the roles of these healthcare professions, and it teaches them to be comfortable in communicating or going to healthcare professionals for their care. This is to hope that in the future they will feel a lot more comfortable in going to their healthcare professionals for their health, and hopefully it will lead to greater health outcomes. So what are the steps to creating a teddy bear hospital? So firstly, there is a registration. So you need to register the child in the hospital. And step 2, the doctor's visit. So the children have to take their teddy to the doctor to check their teddy's health. It's a super cute little interaction with the doctor where the doctor will do a checkup of the teddy and give care and advice as necessary. They could, for example, wrap the teddy's arm with a bandage, or another could be they give a pretend vaccine to the teddy, and then the doctor will end the visit with providing the teddy and the child a prescription for a fruit. So step 3, the prescription of the fruit is taken to the pharmacist or the pharmacy student, and they will supply the child with a fruit. So implementation of this event. So I've put a list of main necessities that I believe are important to creating this great event. So first, collaboration. Of course, you need to collaborate with other healthcare associations. This would be the first step and the most important. Firstly, you would need to collaborate with the Medical Students Association, and then I would look at furthering this collaboration with possibly other healthcare professions, and I will go into that in a bit more detail in a few slides later. And the venue, you will need an appropriate venue to hold the event. Depending on the outreach to the children, you may need a smaller or a larger venue. You will need station areas. So, for example, we have the table in the picture here with our fruit set up. and this is the pharmacy. And so also there should be some kind of consultation room for the doctor and the teddies. So supplies, whatever you decide to use in the consultation with Teddy will be needed. For example, the bandages, like I mentioned before. You could use the other, like some plastic syringes to pretend to vaccinate the Teddy, or stethoscopes to check the heartbeat of the Teddy. Although in a lot of these cases, for example, like stethoscope or lab coats, those things are usually already owned by the students. So pre-printed prescriptions with the fruit on it are essential. It's great if you can make the prescriptions as realistic as possible. So use a template or create your own based on your own knowledge of what prescriptions look like in your country. Fruit for the pharmacist to supply. So of course we need the fruit or the medicine to give to the child slash teddy. Fruits I would recommend are like bananas, apples, mandarins, like what we have in the picture. These are cheap and children really love these kind of fruits. So number 5, you're going to need willing students to participate. You need to organize students from all of these healthcare associations to act as whatever they are, say student pharmacist or student doctor. And what I recommend is have each association organize their own students. Don't have this as your own association organizing everything for everyone, as that would be quite difficult. And if your event is anything like the one that we are able to do every year, then you'll have absolutely no problem finding willing students for this. And so some other things is you need to have signs to indicate it is occurring, posters for advertising, and other kid-friendly ideas or activities. For example, like balloons or fun activities, such as some exercising activities. So do not forget the advertisement. So these are just some examples of some online articles that were written about the teddy bear hospital that we were able to take part in. You need to remember that this is an event for the public. So using social media or newspapers are a great way to reach out to the public to let them know that it's happening. And then once your event, if you make it an annual event and it picks up a lot of speed, then the general public will start to know by word of mouth that it is going on. So what other activities can you do as part of the teddy bear hospital? So the great thing about this is that you can actually incorporate so many different extra activities because kids love to get involved in new and exciting things. In recent years, we also had physiotherapy students join us where they had some fun physical activities for kids to take part in, something like hopscotch or that kind of thing. There was also an early childcare service that came to help with the day. So things like this are really great to incorporate as well. It's also great to encourage those that have low healthcare outcomes or are less likely to access healthcare services in your country. Something that is a bit more New Zealand specific, but is becoming really increasingly important here, is catering to Māori, the native people of New Zealand. So this year we included a Māori student doctor who spoke fluent Te Reo Māori, which is the language of Māori. And this was an absolutely great idea, as it also included Te Reo consultations and prescriptions. So children that were from these families that are more likely to have worse health outcomes were turning up to this event, and a lot of them were coming. And it's great to encourage these people because then that will help them with having better healthcare outcomes. And there were also some fun activities such as face painting, and there were some student doctors who were giving away finger glove balloons. So why do this event? Obviously, first and foremost, we want to do it for the kids. We want them to see that healthcare professionals are not scary, and we're always here to help them when they need us. We want to give them the confidence to go see a healthcare professional in the future when they need to, and we want to educate them on the different roles of healthcare professions and do this in a fun and interactive environment. I know that many of you also would know that a lot of kids, they probably don't know what the pharmacist actually does. Even some adults probably don't know. So it's really great for us to be able to educate these kids early. And not only that, but it's also a great event for healthcare professionals and students. So for pharmacy students, it's great to collaborate with other students studying towards the healthcare profession. This is how it's going to be when we graduate and we begin work. So it's great to learn how to collaborate and work collectively. And it's just a great positive to this event. And the event also creates relationships between the different associations, and this can become a great path leading to other IPE related activities that you could undergo with these student associations. So that is the end of my presentation. If anyone has any questions, please post them in the chat and I will be more than happy to answer any of them. Thank you all.
Thank you, Ruby, for your wonderful presentation. So if anyone has a question, please type I into the comments chat box section, and then I will pass the floor on to you so you can directly ask your question to Ruby. Or if you are a bit shy, you can also type in your whole question into the chat box, and then Ruby will answer the question that way. And if you do find that after this webinar you have more questions about the Teddy Bear Hospital, please feel free to email the APRO RPO as well. So if anyone has any questions, please type into the chat box. So I see no questions from anyone at the moment. So I'll just ask a couple of questions for Ruby. So with the event for the Teddy Bear Hospital, so it's mainly targeted towards young children. Is there like a specific age range that is more suitable for the event?
So thank you for your question, Wendy. I would definitely say that toddlers are around the age that this event is more suited for. So age range, say around 2 to 6 years old, even maybe 7 or 8. But a lot of the activities were very for kind of kindergarten aged children, so toddlers, and we had a lot of like face painting and early childcare services that were helping. So it was definitely an event that was for that age range. But that's not to say that an event that someone else would organise has to adhere to the same age range as we did. You could definitely make an event that is for differing age ranges, but you would just have to tweak and alter some of the activities. Thank you, Wendy. Hi, Ashley. Thanks for your question. Just want to clarify, do you mean like the country or the actual venue? Thank you. Okay, so the actual venue, we had this in what is called the Hunter Centre, and it's in Dunedin in New Zealand, and it's actually kind of like a hub for healthcare professional students. A lot of us go there in between lectures and things, so we were very familiar with the layout of the venue. It has a lot of kind of workshop areas or rooms for training sessions and things like that. So it worked really well that we could have all these separate rooms for the consultation and then have a larger area for the different fun activities to do. So I would definitely recommend if you can do it in a local place where it's very easy for the public to access and as well as the students. Um, and something about Dunedin is that it's very everything is very close to each other, so it was very easy for us to source a venue in that aspect. Thanks, Ashley, and your shy friend for the question. So, in terms of improvements, I would just recommend things like um, increased activities for the kids to take part in. So we did have a lot of activities. Um, however, they they weren't all catering to, um, I suppose, the same uh, kind of people. So face painting is not for everyone. So things that maybe we could incorporate is like having some kind of clown or like have a wee movie playing in the background or something like this would be really great. As well as in terms of the pharmacist, we only give the fruit out and we wait for the child to come get the script from, give us the script, sorry, and then we just provide the fruit. But definitely it should be more um, like advice given by the pharmacist so that we can really show these kids that pharmacists actually don't just give you the medicines or the fruit in this case, but we actually, we know some things about medicines or maybe fruits in this situation. So yeah, definitely more role for the pharmacist would be great. Thank you. So Stella, I hope I'm pronouncing your name right, has just said, in my country, Slovenia, students visit kindergartens and have a teddy bear hospital there. Thank you for your comment. That's really great. Actually, that's great to hear that you visit the kindergartens themselves because that would be a great way of reaching out to a lot of children that would absolutely love this new and exciting visit by these students. So thank you. That's a really great idea. Hi, Nirmal. So, how many doctors and pharmacists in total were involved in this activity? So, if I were to, I don't have the exact stats or anything with me, but if I were to kind of um, guess off the top of my head, we had a roster of various pharmacists from our association that would come throughout the day. We had about 3 or 4 pharmacists at any one time, and we had about 7 sessions and yeah, 3 or 4 pharmacists. So well over 20 pharmacists were involved in this. And in terms of the doctors, there was actually quite a few because there would be about 10 doctors, 10 or 15 doctors just for the registration phase. And then there would also be 10 or so doctors for the consultation. And then there were a lot of extra doctors floating around, just, I guess, enjoying the atmosphere and the environment. So, yeah, there was quite a few students involved in this activity. Thank you for your question.
Die Stummschaltung ist aufgehoben.
So thank you, Ruby, and all the participants who participated in today's webinar. Really thanks for all the fruitful question and the awesome presentation. So now I see no more comments or questions from the floor, and we would like to end the webinar here. So we have still one more webinar left tomorrow. Please feel to join also on the tomorrow one, and see you again. Thanks for participating. Bye bye, guys.